Good afternoon, everyone. My name is Peter Fabricant. I'm a pediatric orthopedic surgeon here at the Lerner Children's Pavilion at HSS, and I specialize in sports injuries and fractures in children. On today's webinar, we are going to talk about keeping kids active and safe at home, specifically during the coronavirus pandemic, as well as preparing for return to normal activities, and on injury prevention and sports performance strategies as we return back to a new normal. Our guests today are Dr. Kathryn McElheny, who has specialty training in both pediatrics and in primary care sports medicine. She's also the non-operative medical director for the New York Mets baseball team. Also, we have Joe Molony, who is the manager of our young athlete program here at HSS, and he has special expertise in young athlete physical therapy, sports performance, as well as injury prevention. So thank you for joining us today. And thanks, Joe and Kat, for joining us as well.
Thank you.
So let's get right into it. So I want to start with talking about injuries that we see frequently in our young athlete population. So Joe, what are some of the most common injuries or conditions you see in kids, maybe focusing on the lower extremities?
Sure. So the first big category of that would be what's technically termed as apophysitis. So this is irritation at the growth plate where a tendon attaches to the bone. So when we start sort of at the ground, that happens in the heel. At the knee, we see conditions like Osgood-Schlatter, which is right in the front of the tibia, just below the kneecap. At the kneecap itself, there's a condition called Sinding-Larsen-Johansson. We also have multiple places in the pelvis where that can happen. And again, these aren't structural problems, just irritation. These kids can also get tendonitis just like the adults. So even though they have injuries that are specific to their population, it doesn't mean that those are the only things that happen. We certainly see other just overuse injuries like stress fractures. We can also have traumatic injuries, soft tissue injuries like an ankle sprain, ACL tears. That would be another example of that.
Absolutely. And then Kat, you spend a lot of time taking care of baseball athletes and athletes in general. So why don't you give us your thoughts on upper extremity injuries? What are you seeing most commonly in your practice?
Yeah, so I think a lot of similar principles to what Joe already went through. You know, apophysitis is a big contender in terms of the pain that happens on the inside of the elbow and in the shoulder with throwers in particular. I kind of think about these upper extremity and lower extremity, for that matter, injuries in two separate categories. One being your open growth plate, skeletally immature patient, and the other being your more skeletally mature closed growth plate patient, because I think it kind of is two different beasts, if you will. So, you know, if a little league kid comes in and has pain on the inside of their elbow that's been kind of chronic in nature, I'm thinking that it's probably an irritation, as Joe mentioned, of their growth plate or an apophysitis. If they've had a pop and some swelling and it seems more acute in etiology, then it could be that they've actually fractured that growth plate and have had an avulsion fracture in that same area. Now, if that same kid is a high school senior and walks in and says, hey, I've got an acute pop and pain and swelling on the inside of my elbow after a throw, then I'm thinking more actually the UCL ligament or the Tommy John ligament. And the reason behind that is just that in younger kids with open growth plates, the growth plate is weaker compared to the surrounding structures. So oftentimes it takes the first hit. Whereas in older, more skeletally mature kids, you'll start to see more of the ligament and tendon issues. I think the same principle applies for the shoulder. You can see little league shoulder, which again is an irritation of the growth plate, commonly in your little league population. Once you get up into your older high school, older teen population, you're seeing more rotator cuff tendinitis, labrum pathology, etc. And I think it's important to also bring up that this is not specific to baseball. You know, it's called little league shoulder and little league elbow because it's commonly seen in baseball, but we see this in tennis players and swimmers, etc. And in gymnasts in particular, we see it at the wrist because they're loading their wrist, and there's something called gymnast wrist, which is also similar in terms of a growth plate irritation. I think, as Joe mentioned, there's always room for traumatic fractures, for acute muscle strains, and other forms of tendinitis, tendinopathy that we can see. And I think you're probably more the expert on the fracture side of things, as well as osteochondritis dissecans, which can be seen in the elbow. So might be a good way to bring in some of your thoughts.
Yeah, no, for sure. And I think that especially now during this quarantine, during COVID-19, and even during, you know, non-pandemic times, so in the winter when kids are kind of cooped up inside, a lot of kids are getting kind of low energy fractures from staying inside. Perhaps their vitamin D levels a little low from not getting a lot of sunlight. They're jumping off of bunk beds or couches and injuring themselves. And then certainly as either the weather gets nicer for your typical winter, or as the coronavirus restrictions will at some point become lifted, I think as kids then go back outside and start to go crazy a little bit, we're going to see a lot more acute injuries and fractures as well. So I think talking about injury prevention is really going to be an important thing, and I think we're going to certainly touch base on that in the rest of this webinar. So, Joe, what are your thoughts, at least on the injuries that you kind of described? What are some of your thoughts on strategies to prevent these injuries from happening in the first place?
Sure. Well, an interesting thing is that about 50% of injuries in this population are preventable. And some of that could be attributed to 50% also being overuse. So you can sort of put those two together and say, all right, well, if 50% are overuse, and as adults, we make sure that youth don't overdo it when it comes to sports and loading, and when it comes to rest, we might be able to cut those numbers in half. So that right there is a big strategy, the total loading. Progressive advancement back to play. So again, in the current situation that we are, shelter in place, or at the end of the summer, as an example, for people to transition slowly back to their sports. So again, that their bodies can handle the load that's being placed, needs to adapt. And then American Academy of Pediatrics came out with guidelines for sports specialization that anyone can access online if they go to their website. And there are a couple key pieces of information there with regard to injury prevention. The first of those is that youth should have 3 months non-consecutive times of rest throughout the year. So not actively participating in a competitive sport. Now, certainly in our current society, so to speak, here in the US, could be challenging for a lot of people if the child's trying to play a club sport. Another one is, again, focused on rest, which is 1 or 2 days per week. So we shouldn't be placing those forces across the body 7 days per week. Another guideline is no more hours per week than the individual's age, up to a maximum of 16. So a 12-year-old shouldn't be doing more than 12 hours per week of that sport. An 18-year-old shouldn't be doing more than 16 hours, as an example. And really important to be well-rounded. So early specialization can lead to injuries. It also does not necessarily lead to late specialization. The reverse is true. So we want to keep things diverse in those early years as well. Strength and conditioning programs are also very important. And those can be even simple. They don't have to be complicated. It can be single leg squats, calf raises, push-ups, sit-ups, single leg balance, a few days a week. Or you can go certainly much further if you want to engage a trainer or somebody else or someone knowledgeable who can give you a more detailed program. Formal injury prevention programs exist out there, such as our HSS Sports Safety program, which does lower extremity and upper extremity prevention programming. And I think a big one is phys ed. We certainly see that being peeled back in our schools, done in blocks. Again, if you look at the AAP guidelines, we need early movement diversification. So if phys ed were done on a year-round, all-time during school basis, not sort of in blocks like that it's a daily thing throughout the whole school year, that will make a big difference in the long run of helping to prevent injuries as well.
Yeah, I think that's really important and a great point. It's really, we need to teach these kids how to move. We need to give them the building blocks in order to be successful at the higher level, kind of more complex movements to prevent injury. That's a really good point. Kat, what are your thoughts along those lines?
Yeah, I mean, I think Joe hit a lot of the highlights, and I'll maybe just add in a few kind of sports-specific anecdotes and just kind of reemphasize a few points. And that's the most recent one you said, which is, sports-specific movement patterns, functional movement patterns, and just getting strong. Pitching while fatigued is one of the few consistently demonstrated risk factors for injury in the youth rowing population. So I think that the stronger you are, the longer you're going to last per outing without having a risk of injury. And I think that's a really crucial concept for these kids to understand. I think it's also doing the right type of strengthening, and probably Joe could speak even better to this than I can, but I think it's not just going to the gym and doing bench press or doing bicep curls. It's working on those functional movement patterns. It's working on your shoulder blade if you're a thrower. It's working on your core, your legs, your butt, toes to fingertips is kind of what I always tell a lot of my throwing athletes. So I think that piece is important. And then also muscular endurance in addition to muscular strength, and just being able to maintain that over the course of several innings. I think strengthening the right way also means not strengthening in a risky way. I talk to a lot of kids who use weighted balls and end up having injuries from using weighted balls. So I think being a little cautious about the use of certain adjuncts in some of our open growth plate patients, once again, is worth mentioning. Ramp up is very important. It needs to be gradual. And I think rest days are probably almost as important, if not more important, than your overall pitch count limitations, especially as you transition from Little League, where you've got Pitch Smart that's directing you, to the high school level where it varies by state. So I think just making sure, especially coming out of this pandemic mode where everyone's going to be really anxious to get back out there and return to their throwing programs, that they incorporate adequate rest days. I think mechanics are one other thing worth mentioning, particularly with the overhead athlete and throwers. And I think it's not necessarily your baseline mechanics as much as it is the way your mechanics change with fatigue. So that again speaks to the importance of getting strong in the right way. And then I think last but not least, just kind of reemphasizing the importance of sleep and nutrition, and not just sleep, but uninterrupted sleep, at least 8 hours, if not more, in this age group, and regular meals and adequate nutrition.
Yeah, those are all great points. Those are all great points. And I think that one thing that when Joe and I see patients together, a lot of times I hear him telling patients it's not just about the muscles that you can see, it's about the muscles that you can't see. So like you're saying, working on things like rotator cuff and hip and core strengthening instead of just working on the bench press is certainly important. So to that end, kind of what are some of the things, and why don't we start with Kat, what are some of the things that you think are good ways to engage kids in activities, either with or without their parents, with a specific or a particular focus on things they can do now, maybe during quarantine?
Yeah, it's funny. I feel like I've done a lot of research on home fitness resources, not just for my patients, but also for myself. And I feel like I've found that the Peloton app is my favorite. I think everyone thinks that it's mutually exclusive with the bike, and it's not. It's $12.99 on the App Store. You don't have to have a bike. I actually ended up getting a cheap spin bike, and I still can do the Peloton apps on the spin bike, but really I use it more for the strengthening classes, because they've expanded this app, probably in light of all of the home quarantine situation, and it now includes strengthening as well as high intensity interval training, running inside, running outside, yoga, meditation, etc. But in terms of specifically the strength classes, you can really individualize them. So you can pick anywhere from 5 to 30 minutes. You can choose if you want to do core for runners, body weight, actually use weights, upper body, lower body. You can pick the instructor, the genre, the music type, etc. So it really allows you to have some variety and some individualization to your routine. And I think it's totally something you could do with your parents if you're a kid, or your siblings, and it doesn't take a ton of space or equipment. A lot of kids I know are also doing virtual workouts, like Zoom workouts with their teams. I think that's really nice. I think it allows them to maintain some sort of a schedule as it pertains to sports and a routine, but it also allows them to maintain that camaraderie with a lot of their teammates, which I think probably they're really craving and missing. I think simply getting outside and taking a walk can't be undervalued. Going outside for a jog, similar principle. I would say that there's some reports coming out that when you're jogging, the way that you breathe, you potentially need to obey more of a 15-foot rule as opposed to a 6-foot rule. So just being cognizant about wearing the mask when you go out. But I think getting out and jogging, getting out and walking in the sunlight is good for both body and mind. If you do have a spin bike, I think, again, getting on the bike is a great way to stay fit. And also you can use that Peloton app if you need to. For certain other specific things, for some of the kids I know that are dancers or like the boot camp aspect, the OB Fitness is a nice resource. There are virtual personal trainers that you can find. There's something called Live Kick. I think doing Pilates on YouTube is great. Jessica Vallant, someone I really like on YouTube. And then I think for those kids who might be actually dealing with an injury, it can't be underemphasized how valuable doing telephysical therapy could be right now. And we've got great resources here at HSS as well as throughout the city with providers who are able to do those one-on-one physical therapy sessions virtually. So those are kind of the main resources I've found.
That's a great point. So Joe, what's just to just to get your thoughts on the tele PT. So how has your experience been with that with kids? How does it? What things can you do via telemedicine that that give patients kind of a similar experience to being in the gym? How's that been for you?
It's really been fantastic, and we're looking at trying to put some things out to describe that in the literature because it's really not described much. I mean, unfortunately, pre-COVID, no insurance company was paying for telehealth PT, and those things have been lifted as well as state regulations. So right now here from HSS, we're doing it across the country. And what I'm finding is it's actually an enhancement to care, not just a replacement for in-person. I think it has a long-term role. And some of the examples of that are being able to optimize or idealize the person's program to their home environment. So, you know, when they come into the gym and you're setting them up on exercises, you're bringing them onto perhaps a treatment table, you're putting them on specific equipment, and you're describing what they should be doing at home, and you're having them demonstrate that. But the reality of how that's being translated at home has been very different in this telehealth environment. And so I think, you know, if you look at a long-term, how could this be an adjunct, seeing people in person as well as on that same patient through telehealth. I had a patient, for example, who was having some hip pain riding his bike, and he's a mountain biker. Well, at home, I could see him through telehealth on his bike, look at his positioning, telling him what needs to change. I can estimate or approximate that in the clinic through discussion, but I really can't see it firsthand, right? So I think that's probably the biggest piece because, again, in this population, home programs are vitally important. Coming into PT 1 or 2 times a week for a lot of conditions is not sufficient. And even looking at simple things about where can they set things up at home to stretch effectively, move around the house with them and see what that is. Another last example, I had a patient the other day who has a stationary bike at home and using wattage to monitor or dial a patient in where they should be as far as a workload level is very helpful. But many stationary bikes don't have that. Well, this one happened to have it. And as the child was on the bike and started pedaling, and I was looking at the panel and Dad was there, I said, okay, do we have a wattage option there, which we did. And so I taught them how to turn that on and then set the resistance, which would be separate, and then said, all right, here's the wattage range I want you to work in until I see you on your next visit. Again, we try that when they come into the clinic. They don't necessarily know if they have wattage. You have to wait a week and they have them come back and tell you whether or not, you know, they think they had it, but maybe they weren't sure how to set it up. So I think this has been extraordinarily advantageous.
That's really cool. That's really interesting. So we commonly think about, you know, the PT gym has all the specialized equipment, and certainly there are things that you can only do in the PT gym. But like you say, these kids are spending, you know, 99% of their hours, you know, not in the PT gym, they're at home, and we need to get them good home exercise programs. And to have the PT essentially, you know, with the kid and with the parent in the house, training them how to do the exercises at home, to your point, it's almost even better than being in the gym in some respects. That's really interesting. So let's just shift gears a little bit and talk about the amount of activity. So Kat, how much activity is really enough for kids? We kind of talked about some of the activities to do, but what are your thoughts as far as either how much activity they should be doing and kind of any specific stretches or anything like that?
Yeah, well, the CDC recommends for kids ages 6 through 17, at least 60 minutes or an hour of moderate to vigorous physical activity daily. They mentioned that at least 3 times a week, that should incorporate specifically strengthening endurance or aerobic activity and bone building. I think a lot of those things are one and the same. Obviously, if you go for a run, it's both aerobic and bone building and strengthening for the lower extremities. So I think that a lot of times you can accomplish all 3 in one. But those are sort of specific minute-wise parameters. And then I think as it pertains to specific stretches, I mean, hamstring flexibility, especially in our rapidly growing kids where their skeletons are growing much quicker than their surrounding soft tissues, is important. In a more sports specific sense, I think for our overhead athletes, the shoulder mobility is important to maintain. And I think we used to think that it was all about maintaining their internal rotation ability of their shoulder, but now we realize it's more their total arc of motion. So maintaining that entire arc of motion is important. And then for some of our lower extremity athletes, but also upper extremity, I mean, it's crucial in pitchers as well. Hip mobility, I think, is probably really important to be maintaining during this period. The one thing I do want to actually get Joe's input on, though, is the strength training, because I think that's a question that I get a ton from parents. And I think I've had conversations with him before, and he's great at explaining this in terms of how would you advise young children on what's appropriate as it pertains to weight training, in particular for strengthening.
Sure. So I think a basic concept that parents aren't quite sure of, a very fundamental piece, is can they strength train? And I think we've had these longstanding rumors about strength training being bad for the growth plates, which it certainly is not. So I think the first myth to dispel is that. And then the second layer of that is from a safety perspective, body weight exercises are highly safe. So when you think about things that kids do and jumping off of a high surface, landing, running, if they're doing things like, and I'll just put maybe straightforward exercises like a double leg squat or single leg squat, push-ups, sit-ups, like we talked about earlier, planks. The forces through the body with those do not in any way approximate the forces that they would put through in their, at the playground, right? Running around and just having fun. So I think those are two key factors. I think the next one for the young population is really for parents to keep things as fun as possible. So that's more on the just overall activity side of the equation. And then from a strengthening perspective, the basics of body weight, so squats, single leg balance, core activities, single leg squats. Although in the younger population, that may be a little more challenging, right? So your adolescent may not have much of a problem doing those things because they recognize the value of it to their sport. But anyone, is more likely to do something if they enjoy it. So to the extent that parents can make a game out of it for the younger kids, and if you want to invest in some equipment, bands are easy and relatively not expensive and easy to store. So those can be added in to arm exercises or standing and doing things. I think, the challenge right now is, and here at HSS, I think we're working on that digital strategy, particularly in rehab and performance, of how do we, because parents want to know what's safe, right? And they want to have examples. And it's tough to, on your own, go out on the internet and try to find things that are reliable. So, I think that's really a next step that we see that would help. So to the extent that you can do body weight exercises, make it fun, competitive on some level, not necessarily keeping score, winning and losing, but in a way that makes it exciting for the child, right? Because that's where you're going to get engagement. So, we don't have problems getting people to ski, right? It's not something that we have to push. People love it. They're going to go do it. You create that same kind of scenario in your home environment, understanding and recognizing what your children enjoy doing.
That's a great point. Yeah, and you could even, I imagine, use these kind of social media platforms or Zoom or Skype to kind of like engage, kids and their parents and maybe their friends, and have almost like do a class together, or like high intensity interval training together, like Kat had mentioned, making it a bit of a competition. And yeah, for sure, it sounds like, body weight exercises, as long as you're doing it with the correct form, shouldn't cause any problems for our kids.
From the stretching perspective, you say, well, how do I get, my kid to stretch? I mean, it's so hard. It's so boring. Again, it's a delay of gratification kind of thing. You get more flexible, maybe better at your sport as a result. I think some of the things that can be helpful are if you set it up in a way, so a hamstring stretch in the doorway as an example. So if the person was lying down with an open door, prop their heel on the door frame with their other leg just lying down on the floor, and just sort of inch forward until you feel a stretch. Well, you can lie there and get screen time. So maybe make it as somewhat a reward. You do your homework and you need a break. We'll give you some screen time, but you have to lay there and stretch your hamstring. And you do that 2 or 3 minutes on each side, and now you've got a 5 or 6 minute break that they're having fun during it, but at the same time being able to stretch. So again, that's just another just sort of overall technique in trying to keep kids engaged and getting what they need out of it, because as Dr. McElheny had mentioned as well, that that flexibility is critical for injury prevention.
Great point. Great point. You can entice them with YouTube videos. I like it. So let's maybe it's a little bit wishful thinking, but let's fast forward a little bit to returning to the new normal. Let's say as the virus kind of becomes more contained and we are letting kids get back into their sports and activities outside. Joe, kind of what are your thoughts and what's your advice on kids returning to their sports after this period of decreased activity levels? As much as kids can stretch and exercise, indoors, it's probably still going to be limited compared to what they were doing before the coronavirus pandemic. So kind of what's your advice on kids as they kind of emerge and go back to their normal activity levels?
Yeah, I think, the big one that has come to mind for me is the recognition that kids are going to really want to just cut loose and do more than their body can tolerate after all this time. So as adults, we're going to have to constrain that. So we had this level-headed gradual progression back to that loading. And, that can be through the amount of time per day initially that kids are doing things. It can be how often that they're doing them. We can also think about rotating the forces between lower body and upper body, right? So, have your child doing, running around and leg type things on opposite days of doing upper body type things. So maybe that at home doing some exercises with bands and push-ups and planks, and then on your other days running around. So I think recognize the kids are going to want to do that. Be prepared to have some containment and a bit of a plan around that so that we can allow that progression to be gradual. And, to the extent, as you just mentioned, that you could perhaps start that now at home before people start to go outside so that we have this continuum. And I think, the other piece is look forward. I've been asking families that now, we really don't know, but when do you think you might be beginning sports participation that we need to target that time frame? So we have a sense of when that might be. How much time do we have to sort of ramp up? And as both of you mentioned, we now are seeing Zoom classes and phys ed via Zoom, which I think is great. I mean, that's been a great mechanism for people to start to move in this direction as well. And, again, simulation, things like jumping jacks, jogging, any home exercise equipment, but try to simulate the sport that you're going to move towards. So if you're a swimmer, use the bands, do upper body work, progressively get yourself stronger. Think about what does my sport demand and what can I do to use those same muscle groups at the same intensity and ultimately for the same duration. And is it high power or is it more endurance, so that your activity is sort of specific to those parameters?
Yeah, those are all great points. And I think that we see this every year, especially going from winter to summer or from summer break into the fall school year, that kids kind of just want to cut loose and do everything all at once. And those are during times where there's no social distancing restrictions. Kids are allowed to go outside. So I would expect that's all those points you gave are, as important, or if not more important now, as we're kind of going from a really restricted phase out into eventually a more normal phase. And I think that also, in addition to that, it's really understanding how to kind of fuel these kids as well. Dr. McElheny has a good background in pediatrics and primary care sports medicine. So Kat, what are your thoughts on diet for these kids and kind of how to give them the fuel they need to perform as they get back to this new normal, once we are able to do that.
Yeah, I think that's a great question. I think it's kind of two pieces. One is how do we make sure they have the fuel they need and the energy availability once they're starting to be more active. And I think the other piece of it is what can they be doing right now from an immune function perspective, nutritionally speaking, to kind of protect themselves and try to optimize their immune function. And we've been working on this a lot with our team dietitian, and she's given me some specific pointers about certain food groups and whatnot that I'll run through. But I think in general, as an overarching principle, now is not a time to be really exclusive or restrictive with your diet if you haven't been previously. Similar to exercise, in terms of immune function, what we do know is that if you're probably, if you're someone who's never exercised, it's probably not a great idea amidst a pandemic to go out and start doing crazy intensity exercise, kind of 0 to 60. Similarly with dietary things, I think that if you have previously been a pretty non-picky eater and eat all the different food groups, and then all of a sudden you decide to go plant-based or vegan, probably now is not the time to do that. You want to make sure you have a good, consistent, balanced diet with regular meals. And I think that part of that diet needs to include healthy fats. So your nuts, your nut butter, avocados, olive oil, avocado oil, and then the foods that are rich in those fat-soluble vitamins, which are A, D, E, and K. So your meat and dairy, eggs, and those bright-colored fruit and veggies. Probiotics can be helpful from an immune function perspective, but also just from a gut biome perspective. So making sure these kids, if they like it, have a source of yogurt, like Greek yogurt, for example, and high fiber foods like fruits and vegetables, whole grains. So this would be a great time to make them smoothies. Greek yogurt, frozen berries, spinach, and a banana actually tastes better than it sounds. And then loading up on some of the omega-3s and flavonoids is also good from an immune function perspective. So omega-3s, you're probably not going to get a kid to take a fish oil tab, but fatty fish in general for dinner would be a great choice right now. Salmon, sea bass, trout, shrimp and chia seeds and walnuts are also great sources of omega-3s, as well as edamame. And then flavonoids is going to be more an antioxidant approach. And so that's going to be more of your onions, kale, grapes, tea, etc. So I think thinking about some of those specific food groups is helpful around this time, as well as just maintaining variety and consistency, not skipping meals. I often get asked what supplements are protective as it pertains to immune function. And I think that the three that have probably been studied the most, granted those studies have variable results and those results vary based on the dosing regimen, the frequency and the dosage, et cetera. But vitamin D, vitamin C, and zinc have all been looked at in the setting of athletes. And I think that vitamin C and vitamin D are pretty easily obtainable in an over-the-counter supplement as guided by your pediatrician. They make those in gummies. Those are pretty kid-friendly. Zinc is tough to find right now, just in light of COVID. I think it's pretty much sold out at most places. So zinc-rich foods are your oysters, crab, lobster, meat and poultry, and veggies, in particular the mushrooms, broccoli, kale, and garlic, as well as some of your legumes and beans, nuts and seeds, whole grains, milk and dairy, and even dark chocolate. So those are some of the specific nutrient recommendations that we've been trying to give to our athletes, just based on various forums of people around the country talking about how to manage and protect athletes during a pandemic. But I'll let Joe speak a little more to some of the general principles and some of the patterns that we see in kids, because I think he sees that in some ways even more so than I do.
Yeah, before we do that, I just want to make sure I heard you correctly, so I can go and binge on dark chocolate. That's okay?
And everything in moderation.
And avocados.
And avocados.
Yeah, so I definitely want to hear what Joe has to say. I mean, I've heard a lot of really smart people talk about young athletes and diet. And I think it's really important to say that, our young athletes, they don't really diet and exercise. They really need to fuel and train. And so, Joe, what are your thoughts on kind of, as these kids are ramping back up with all those techniques you had mentioned, kind of what's a good way for them to fuel?
I think this is probably a great time to work on developing a good eating habits. So, just to sort of back up, and we've touched a little bit about fatigue, being run down, and injuries in a fatigue state. And this does play into nutrition on two levels. So, one of the things I think we see a lot of are kids not being able to get enough sleep. So the demands once they're in school, They are staying up late at night because they're coming home from practice, have a lot of homework, may not, in some cases I'm hearing patients come in getting to bed around midnight or 1 in the morning and getting up at 6. Well, how does that relate to nutrition? They're trying to get out of the house and they don't eat. So you say, well, and breakfast is important. We need to make sure breakfast happens. Well, that starts the night before by figuring out how we get a child to bed early enough so that they don't have to rush out. And certainly that has the added benefit of making them feel restful the next day and helping to prevent musculoskeletal injuries. So the other habits, so, starting off with breakfast, having at least 3 meals a day, but preferably more along the snacking. So we've got a continuous influx of nutrients throughout the day. As Dr. McElheny had mentioned, we got a lot of different foods. We want a lot of variety. Rule of thumb to have a lot of color in the foods throughout your day. So without having to look at something really specific, if you say, okay, make sure you eat a good breakfast, make sure you're eating snacks in between and you're getting lunch and dinner, have a wide variety, cover all the groups. If you're lactose intolerant, don't just keep dairy out of it because there are lactose-free foods available out there. And then another one would be for those who are not eating breakfast because they don't enjoy eating breakfast on some level. So it's maybe not a timing thing. To, again, think in terms of developing the habit. So getting a patient to eat something at all that they enjoy. And Dr. McElheny and I had a patient who fell into that category and started off eating nachos for breakfast. And while that sounds a little bit bizarre, it's at least better than nothing, but it helped to develop the pattern where week in and week out, ultimately, they ended up having a breakfast of eggs and potatoes, which the parents had been trying to get done for a long time, I think more than a year, and it wasn't happening. And it probably wouldn't have happened without that dial back, let's figure out, get the person in the habit, let them eat something that they want, and then migrate that over. So I think, put that all together. And I think the last point, again, while we have maybe people have some more time on their hands, would be to look at education, try to get some more information. There's a lot to know out there. There are a number of websites. One of the ones that may be easy if people are listening to remember is Nancy Clark RD for registered dietitian. Nancy Clark is one of the longstanding sports nutritionists out there. Great books, great website. So it'd be a great first place to sort of go if you want to start to learn and drill down to more of the details about what types of foods to eat ahead of practice, what should you be ingesting during a practice, what about right after practice for recovery. So those just go beyond those basics of having a lot of variety of foods and eating frequently throughout the day.
That's great. So nachos for breakfast and dark chocolate for lunch. I love it.
There you go.
Fantastic. Yeah, we're starting to run a little short on time. I really want to thank both of you for joining us today. So just to kind of summarize what we talked about kind of common injuries that we see both in the upper and lower extremity, overuse injuries and acute injuries. We talked about strategies for injury prevention, including working out from home, keeping it interesting for kids, and using different platforms to do that. In kids who are injured, certainly telehealth or tele-PT is a great option, and that basically gets the therapist into your home environment. And then we also talked about kind of working on a return to sport in a gradual way to make sure that we do continue to prevent injuries, and then fueling that return to sport through a diet with a variety of healthy options and education. And I think this was a really helpful thing to go through, and I want to thank both of you for being here with us. So that is all the time that we have. Thank you again for tuning in to this webcast. And if you have any questions or you want to learn more about HSS or the services we have here, feel free to comment below or visit us at www.hss.edu.